Hi, everyone. Okay, so we need to invite Amy up to come and join us. And thank you, Lydia, for your time in the previous session. So this session, we're going to look at the current successes and some future ambitions for greater awareness. So how do we take some of the stuff that we've heard and we've talked about, and then look at greater awareness? And I'm very thankful to have, and there's two fantastic women join me in this. This is supposed to be a fireside chat, so I'd like a fire. I mean, oh, we can do a pool. We'll do a poolside chat. Well, that's fine. Oh, there we go. Can you feel the sun on your back? So in this beachside chat, I want to thank Amy for joining us. Amy is a patient who is from Senegal and is based in Portugal. And then you all know Lori from the previous session. What I have done is forgotten the questions I'm going to ask on the table. So I'm going to just pop over and then we can start on that. It's because I was waiting for the pina colada to be delivered and it didn't. It wasn't pina, hey, which is right. For those of you that don't know, I'm Lori Pretorius. I'm from Campaigning for Cancer in South Africa. Lori, I wanted to ask, can you share for us an example in France that reached a wider and more diverse audience? And what made that successful? What was something that you can report back to us on that?
First of all, it's important to define what success should look like. That's the first thing you have to do to be able to measure your successes, to know what are you trying to do. And in Bladder Cancer France, we've always had 3 goals for our Awareness Month events. And of course, the first one is to reach the greater public, to reach as many people as possible. The second one is to raise awareness about our patient group, that we exist, so that patients who are already in the system, they can find us more easily. And the third goal we always have is to deepen and establish new relationships with healthcare professionals. We really increased our social media campaign impact from 2023 to 2024. And I'd say probably the biggest factor for that was that we were working with professional agencies who really helped us to plan out our social media campaign. And that's really the biggest factor for us. Also having additional money to put into the advertising budget. You know, if you put 10 euros, you get so many likes, and you put 1,000 euros, you get a lot more.
The reach.
As we just don't have the following and the, to get organic likes from our existing followers. They just don't do it. So you have to pay to get it, and that does work. That gets the word out. And so we were really happy with our numbers increasing in 2024.
So the agency helped you leverage that because of your research. So not only from money, from a reach, but they helped you with physically with did you pay the agency?
Yes, we did. Yeah.
All right. Yeah. I know sometimes we do it. We get agencies to do that pro bono for us. So there's a lot of agencies that we can do. Yeah.
Yeah. I think it was in 2022, we had an agency that worked almost pro bono for us.
Yeah.
A really low fee. And I think we put in like 700 euros for the Google ads and Facebook ads. But the numbers, we got like 36,000 likes, whereas this year I think we were, like in the millions.
And was that because of the direct spend that you'd had?
Yes.
All right.
So and having that professional capacity behind us to tell us what to do and what not to do. In fact, I've got a funny story about that. We had this really great video of hematuria, a patient, peeing in the toilet and having really red, really gory hematuria. And we thought this is a great way to, get the message out. And the agency was like, no, 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 you're all going to end up in Facebook jail if you put that on Facebook. And so we didn't, we listened to their professional advice and avoided a mistake. We also had training. That was a big factor for success as well. We had training with a top-rated agency that kind of showed us around Meta Business Suite. I can't say that I'm an expert. I still am pretty much of a novice at Meta Business Suite. It is confusing. I can never find the right menus and such. But we did do training, and our social media manager, Sarah, really benefited from that. She's much better at Instagram and all that than I am. She that was, just slowly, little by little, we're getting more experience, and the main message is just get the professional help.
Thank you. Amy, I think, a lot of people we have good understanding of what education and awareness programs can look like in certain parts of the world. But I think, could you explain to us a little bit more about the situation in Senegal that patients are facing, and then also, how this would bring challenges to some of the education and awareness on bladder cancer that we would see in Senegal?
Okay, hello everyone. Little nervous, but yes, our key challenges in Senegal is that bladder cancer is the second most urothelial common cancer, and accounting to 18% of all cancer. So therefore, we are a big stigma in Senegal where we don't talk about it, and it's becoming very much difficult to find patients. And also I was told that especially in rural zone, in the villages, where most of the bladder cancers that are 80% affected is by the water from lakes that they're drinking and using. So for that, there are challenges to find them. There are challenges to have them open up, because I use social media for myself, and I was the first one in Senegal to talk about bladder cancer, and everybody would come to my page and say, "You crazy, why are you doing this?" Thinking that because I'm too Americanized to just be open-minded and talk about it. So those are really the challenges right now, to get them into talking about it and going to hospital, and also if we can have also free screening, because they cannot afford to pay for screening and early detectable screening.
Thank you, Amy. So, I think that, that stigma, and one of the best ways on looking at stigma is hearing the patient's voice and seeing other patients tell their stories. It doesn't stop the cultural issues that man, but it does provide you with a sense of camaraderie, and that you're not, as you said, the only person that is telling your story. One of the things that we looked at this year as the coalition was to look at doing 5 stories, women's stories of bladder cancer. And there were 5 countries chosen: Argentina, South Africa, Italy, India, and Canada. I've got them right. I'm counting them. Thanks, Alex. On that. And I wanted to just have a look at, let us have a look at what the story was that came from Argentina, because maybe we can have a chat about that after. Okay.
Fue bastante impactante. Digamos, todavía cáncer es un tabú. Uno asocia cáncer a muerte, entonces fue bastante impactante. Esto lo descubro porque tenía una molestia hace tiempo. Empezó a molestarme como en el año 2018, 2019. Y yo empecé a ver y no aparecía nada. Urólogos, todo tipo de análisis. Después de una ecografía, le digo a la médica, ahí tiene que haber algo, porque ahí a mí me molesta hace mucho tiempo, no se encuentra nada, pero insistí. Y efectivamente ahí apareció un pólipo, dijeron, decidieron operarme y cuando me operaron confirmaron que era cáncer de vejiga. El cáncer fue un disparador para decir, bueno, no me puedo quedar parada acá, no puedo sentir lástima de mí. Y entonces, en medio de todo ese lío, decidí mudarme. El empacar las cosas también es importante porque uno hace como un pequeño balance de su vida, tira cosas, deja cosas. Mis hijos viven lejos, entonces también fue impactante para ellos. Estar lejos y no poder acompañarme. Bueno, están lejos y están cerca, porque tengo contacto constantemente con ellos, me llaman y estamos muy cerca. En el Instituto Fleming me ofrecieron entrar a un protocolo, un protocolo es algo nuevo que se está probando, y lo que me dijeron es que este protocolo ya había sido probado o puesto en práctica con personas que habían tenido cáncer de vejiga no músculo invasivo y que había funcionado bien. Yo tengo cáncer músculo invasivo, significa que el cáncer invadió la musculatura de la vejiga. Al principio es más demandante porque es más seguido, es cada 3 semanas que tengo que hacer inmunoterapia y me colocan por uretra un aparatito que se hace con forma de pretzel y es que tiene la quimio y la va liberando de a poco. Hago mi vida normal, en realidad. Que eso fue muy alentador porque son muchos años, pero bueno, si yo hago mi vida normal, voy al gimnasio, salgo, paseo, si bien me he adaptado al tratamiento, siempre cuando entras a un quirófano, decís, bueno, espero que salga todo bien, espero despertarme, pero bueno, eso me pasa y tengo que pasarlo y bueno, lo he aceptado. Si es posible ponerse en contacto con alguna asociación de pacientes, que es muy importante estar con gente que tiene otro oído para escucharnos cuando está pasando por algo similar. A veces la gente es reticente a juntarse porque, bueno, voy a estar con todos enfermos, como yo, mejor me alejo, pero no, es un engaño. Está bueno estar con personas que están pasando por lo mismo que uno. Uno no se muere antes del último suspiro. Entonces, trato de disfrutar lo cotidiano. Me encanta levantarme, abrir las ventanas, que entre la luz, desayunar rico, tomarme el tiempo, salir, ver las plantas, conectarme con la vida, porque conectarme con la muerte creo que no me sirve. Sé que está ahí, todos tenemos ahí la muerte, y sin embargo vivimos sin pensar que nos vamos a morir. Bueno, este caso es lo mismo. Yo me voy a morir en algún momento. Trataré de vivir lo mejor que pueda mientras esté viva.
I'm going to come and have a seat here now that my head won't be in the way of my head won't sit on the beach, sit back and, because clearly the pina coladas are not arriving. Amy, I wanted to ask you, you mentioned that you told your story online and people were coming back. So is this the only strategy? What are other strategies that you've used so far in Senegal to engage different communities? And what was the impact when those communities heard what you were doing?
Well, they found me very inspiring, and a lot of women contacted me to let me know that they were going through incontinence, because I have to admit that this coalition with Alex and Mary helped me a lot with slides that I could take from them and also from Bladder Cancer Friends in French that I would put on my post just to raise awareness of the bladder cancer, how is it, the symptoms and what to do. And for that, talking about incontinence, talking about my incontinence, a lot of women come to me and say, oh, can I ask you why you have incontinence? I'm having it this way, that way. And I suggest them to go see my doctor, because they're like, we don't know any urologist, because they don't go check. And just as I thought it was menopause, a lot of them also thought it was menopause. So I sent them to guide them who to go see. And also I got in contact with the League LISCA. It's a league that is in Senegal that's helping breast cancer only. But sometimes when they get other people that have other cancers, they can reject them. So they help them and guide them. So I collaborated with them to see all the list of the women that were contacting me. Also, I will take their name and number and I will follow up like I'm a doctor or something, just to check on their case. And matter of fact, there was one woman whose mother was sick, and because of me, I did sell some T-shirts that I made last year, and that money I helped her to go to the hospital. Unfortunately, 2 weeks later, she died. But the daughter called me just to thank me, because if I didn't talk about mine, her mom has been laying down wearing diapers. They couldn't have money to take her to doctors. But when she contacted me, I gave her a little bit of money to help out. And that helped them, even though it was last, but I did something, and that touched my heart. Yeah.
Amazing. I think that at the end of the day, we look at it and we think to ourselves, we want to make this big changes, but sometimes just changing one patient's life is as good as, is good enough.
Sharing is caring.
Yes, yes. You know, Amy mentioned about what she's done on social media. Lori, how do you think we could better support cancer outreach campaigns that are not yet widely adopted, particularly in regions where there's less awareness?
Well, I think it really has to be adapted to each country. What works in France or the UK or Canada isn't necessarily going to work in Madagascar or other countries. Of course, here we can all share our resources and ideas with each other, but it may not be suitable. I think the best way is to encourage, stakeholders to liaise with local resources in the country, reach out to other local organizations like you did in Senegal, find out what they are doing, how are they supporting patients. I think it's really about helping to create connections with the right people and figure out how a campaign would work best in that region. That's, it's about networking for me. And, maybe international institutions like UIC can help with that as well.
I was going to ask you, you mentioned stakeholders.
Yeah.
What stakeholders do you think and partners do you think would be most important to work with when you're trying to raise awareness?
Well, it's really a whole web of stakeholders. There's not just one particular, category that you should be in contact with. It's a whole range of healthcare professionals, nurses, industry, other patient groups, local government also, the World Bladder Cancer Patient Coalition. There's, it's a whole network of people that you should slowly build up relationships.
Amy, I want to understand, has your campaign and your work, have any of the press picked up on that in Senegal?
Yes, it did, because the collaboration I did with the LISCA is now they're helping me get through with the government and with the Ministry of Health, because I told them the way that they have breast cancer the whole month and the whole country talking about it, I want next May 2025 to be a big one.
Yes.
So I'm willing, and after being here 2 days, all night, I'm like, I'm going back to Senegal to make my coalition and make my association to work and find where are these people and help. And I have 2 oncologists and 2 urologists who are willing to help me and accompany me to my goal to reach out to the patient and help them.
Well done. And I think that, when we look at that, what do you think? I want to come back on just on the media, because there's some, we have social media and then we've got the press, and those are 2 different animals. Lori, what challenges should a patient group or a personal advocate be aware of in relation to press and media coverage, during a month, an awareness month and beyond?
In our experience, you have to plan ahead for in order to get press coverage. Many of the newspapers, they plan out their editorial line like months in advance. They leave a little room, for current events, but a lot of their articles and things are planned out several months in advance. We did a press conference in 2023 where very few journalists showed up because we planned it like a month before and it was too late. So the 2024 press conference, we planned it much further ahead and we had a much better coverage and attendance.
Okay.
It's also really important to train the people who are going to be speaking to journalists. There's really a lot to learn about, how to avoid tricky questions. We've had experience in our organization with interviews that went badly and we weren't pleased with the results when it was published. And so we've learned along the way through mistakes how to, plan ahead, how to skirt around questions, like a politician, if they ask you something that maybe you don't want to
Answer the question without answering the question.
And so I really recommending getting prepared for that. What else? We had issues also with paywalls. We've had journalists cover our events and then put it online and then you can't share it because you have somebody to read it, they have to pay. Which I think is really a disgrace, especially when you're talking about charitable events. That's nothing that we can change, but it's worth it asking before you invest time into doing an interview with a journalist. Ask ahead of time, is there going to be a paywall or is this going to be publicly available? Sometimes there'll be a paywall for a few days and then that'll disappear. So
It's delayed.
Yeah.
So, what I'm picking up here, just talking to you two ladies when it comes to the coalition, is that we have so many different experiences, but experiences that could help each other on that. And I'm thinking, we've got Lori, you've been doing this for a while, and you're pretty much not in any way linked to your age, but you're an old hat when it comes to this. And you've got those lessons learned. And then we have Amy, who is starting out, but is learning a lot and, breaking boundaries and barriers where, someone else hasn't walked and as an individual. And I want to know from you, Amy, what would you like the global community to do to help with bladder cancer awareness in low resource settings? What do you think we could do to help?
I would like the coalition to help me, guide me into how to start my own way of raising awareness. I am doing it on my own, and that's what I did. It's already been everywhere in Senegal, even though because I'm known as a fighter anyway, in no matter what. So people follow me in anything I say they do because of who I am in my country and who I represent in my country. So my cancer kind of made them feel like, oh no, everybody but you. So they all want to support. I know the time is gone. So I would like them to help me see how I can fund for screening, early detectable screening. Those are the things that I want, and how to make my May next year to be a big one with grants maybe, and see what we can do as a community to help one another.
Thank you so much. Thank you, ladies, and congratulations on all the work. Great, fantastic work.
Thank you for having me. Thank you.
Now, I've been told if you want to, this is the QR code that you can scan to watch the other stories from the 4 other countries that you saw today. So have a look. They're really amazing. Our team has been watching as they've come out, and they really are. And I can tell you that the South African, just the recording process for that patient was life-changing. And in fact, she got some of her friends, and they've now created a support group for bladder cancer that didn't exist. So even these projects have knock-on effects into patients. So thank you very much.